When would you consider treating someone with hot flashes? We often hear, especially our parents' generation saying, okay, it's a hot flash now, get over it, like deal with it and just get on with it. But it is known, as you mentioned earlier, that there are people who at work hold positions or, even if they're at normal work, it's just difficult to have a hot flash in the middle of something that you're working on, or if you're in a conversation and you suddenly have this thing creeping under your skin. So when does one draw the line? When would you consider treating someone with a hot flash?
So the way I approach it is I look at each patient individually, and when they come to my office, I see what is their level of distress, right? So if someone comes in and says they just want an education on hot flash and they're having some which is random, but they're not overtly bothered by it and they can manage it, I would say let's try some natural stuff, try some meditation, yoga, change your diet, reduce your alcohol. Most of the supplements don't really help as much, but if they want, they can try some of them, but like, primrose oil. And then I said, let's follow up in 3 to 6 months and see how you're doing. Bump up your exercise, a big one. So that's one category of patient. The other category is when it's really, really severe, where to the point where it's affecting their quality of life and their work and their relationships. Then in that case, I talk about the natural options, but I said it's looking so bad that I think you may need something more than just yoga and meditation. So,
Mm.
so we can, and then I look at the medical factors. What underlying risk factors do you have? Do you have hypertension that's well controlled? Do you have diabetes? Do you have any risk of breast cancer? Do you have a history of DVT? Any obvious contraindications, right? If I don't find any obvious contraindications, then I would give them the option, again, age is a big factor. If they're very close to menopause and they're very low risk factor, I may say, let's, consider HRT. But if they have risk factors and they need something, then I would say maybe we should consider an SSRI. So really kind of looking at their medical history, looking at their age, looking at how severe the symptoms is, you kind of tailor the treatment according to that.
And most of the supplements don't really help, the OTC or over-the-counter supplements. Uh, there seems to be like stacks of them in most supermarkets and pharmacies. And it just sounds surprising that none of them would help. Like, is there none of them that would give some relief towards hot flashes?
So the studies have been done and they haven't been shown to. Now there's always a placebo effect, right? So, if someone has, mild symptoms, a placebo effect definitely may help, right? So, but there are tons of them and they're really expensive, a lot of them. So I tell them, I said, if they say, oh, my friend has said I should try ashwagandha, which is the new one, right? The big one. I said, try it for 3 months. Again, there are not enough studies done, but doesn't mean it may not work on you. If you
Right.
feel better, then go for it. Primrose oil was one that was supposed to help. I've had mixed success with that.
Right.
So,
What about soy, the isoflavones? Are
so
they
soy definitely, if you can have, you have to have tons and tons of soy. So you have to have a lot of soy to actually put that much of phytoestrogen into your body, right? And
right?
most of us don't have so much of soy, but there is a supplement in the market called S-Equal, and that's actually a soy supplement that has some studies done to show it has a little bit of benefit.
Right.
Give you
Right.
3 examples. If there's a 48 or a 50-year-old, right, a postmenopausal 50-year-old who's just been gone into menopause a year back, she's fit, she doesn't have any underlying issues, her cardiovascular risk is very low, no hypertension, no diabetes, she's at risk of osteoporosis. I would say, okay, in this case, a good option would be HRT. It'll help you in multiple ways, right? Because you're already doing everything that you need to do. Versus another person who is, say, 50 years old with diabetes, hypertension, her cardiovascular risk is high. I would say, look, in this case, I don't think HRT would be a good option. Let's consider trying you on antidepressants. effects or fluoxetine, any one of them, because I feel like the benefits. So it's always weighing the risk versus benefits in every patient and seeing what is the best choice for them. The third case would be a patient for like history of breast cancer, right? She obviously cannot take any hormone replacement therapy. In that case, and also if she's on tamoxifen, she cannot also take some of the antidepressants because they interact. In that case, I would say we have one of the new medicines in the market called Vioza. It works directly on the neurons that affect the hot flashes, and it's not interacting with any of your medications. Would you like to try that?
Right.
So again, so situation to situation.
Right. What about Vioza is now a newer drug
Mhm.
in the market, and how has your experience been so far with its use in hot flashes?
So I've had good success. I don't have a lot of people on it because it's so expensive. So
Oh,
I've got two people on it. One has a history of breast cancer, who was really suffering for a long time, was on tamoxifen, life was miserable, could not take anything, had tried everything. SSRIs, gabapentin, prometrium. Prometrium could not be taken, but everything, right? So I put her on VO, it's actually worked really well for her. For the first time, she actually feels better. But you have to be closely monitored. You have to do your liver functions, because if your liver functions go off, you cannot take it. So it needs close monitoring. um the other person has also doesn't have a history of breast cancer, but she had some breast um hyperplasia or typical cells in the breast tissue, and so she was not a candidate for hormone replacement therapy, and she didn't want to take any antidepressants. In that case, the Viosa, actually initially she didn't like it, but then she restarted it and it works well for her.
wow.
So yeah, so it's a good medication, but it's still
Mm.
new and expensive.
Mm. And when you say it's expensive, it's not covered by any form of insurance.
So for us, because I'm with Kaiser, it is covered, but we call it the non-formulary and formulary. So, some medications are less expensive than other ones. So, but we need a medical indication. So we have to follow strict guidelines before we start giving it, because
Right.
plus it also needs a lot of monitoring. You have to do blood work every 3 to 6 months.
Oh, all right. And
Yeah.
considering hot flashes can last you up to a decade, it can be a long-term relationship with the drug.
Yeah. And there's not enough studies done on that.
Well, that's
Yeah.
all right. So thank you so much for sharing all the information on hot flashes, and I'm sure with the help of your actionable tips, our viewers will be able to make their hot flashes less
Miserable.
traumatic.
No, for sure. Thank you so much. This is amazing. No, it's important for people to advocate for themselves and find a provider that works for you and listens to you.
Well, that's true. That's true.
Yeah.
Thank you. Thank you so
Thank you.
much.